So we begin again. Let me now open the floor for discussion on the document and the relevant resolution. And I ask delegates wishing to speak to raise their name plates. Let's start with Lithuania, followed by Poland.
Thank you, Chair. Lithuania welcomes the draft WHO European Roadmap for implementation of health literacy initiatives for the life course. We endorse the document as a crucial step in realizing the potential of this underestimated and underused measurement for better public health and improved equity that health literacy is. We strongly believe that the roadmap, followed by the action plan, will significantly contribute to the ultimate goal of equally distributed health and well-being in the WHO European region. Several resolutions, declarations, and other documents have already outlined different benefits of improved health literacy and suggested actions that could be taken. However, built on the aforementioned documents, this roadmap is unique for its unifying and consolidating effect that is achieved by providing the 5 strategic directions. One of them, improving digital health literacy, is of an undeniable relevance in this age when technological advancement is redefining healthcare as we know it. It is accurately stated that digital health should contribute to decreasing inequalities as well as social exclusion of the most vulnerable or target groups. However, great care must be taken when implementing such measures in order to solve the problem rather than contribute to it. To truly fight inequities, it's not enough to ensure that health information in digital communications is reliable, easy to understand, and adapted for all target groups. It is also essential to take care that vulnerable groups have resources and technical capacities to use the benefits of digital health. Otherwise, the already existing gap between the more digitally literate and the vulnerable is widened, taking a step back from the goal of health equity. Lithuania is currently implementing a program aimed at improving health literacy on vaccination. The program follows principles and values outlined in the roadmap, identifying and addressing inequities among social groups, building capacity of relevant stakeholders, implementing initiatives in various environments, and utilizing digital tools. However, much more can be done. We strongly believe that the adoption of the roadmap, followed by support and guidance of the regional office, will mark further advancement in national and subnational health literacy initiatives. Lastly, Lithuania commends the work done by the WHO Regional Office for Europe in the preparation of the roadmap and supports it alongside the draft resolution. Thank you.
Thank you, Lithuania. Poland now, please, followed by Russian Federation.
Thank you, Mr. President. Putting health literacy into the WHO political and technical agenda is in line with the Polish priorities for public health, as defined through our Act on Public Health and its operational action plan, namely Polish National Health Programme for 2016-2020. The strategic objectives of our cross-sectoral efforts in Poland are to increase life expectancy, to improve health and health-related quality of life, and to reduce social inequalities in health. These goals are to be reached only if health literacy rises within the society. The health literacy is a dynamic concept strongly determined by the social and economic development, by new technologies and their challenges. We need to ensure that no one is digitally left behind. Finding information is not a challenge in the digital world, but finding a reliable source of information might be much more difficult. Quality information from a respectable source value most. We can't rely on Dr. Google. In 2018, the patient's internet account has been introduced in Poland. Thanks to that tool, every patient will have online access to personal health information, including received prescriptions, referrals, orders of medical devices, benefits provided and their cost, the clinical choices made by the doctor, nurse, and midwife, and e-medical sick leaves information. To strengthen health literacy measurement, regular monitoring and evaluation at the population, organizational, and system levels shall be one of our priorities for upcoming years. Sustainable health literacy measurement system shall be a part of a public health system. We believe that future work of WHO on mapping and monitoring a range of national and regional health literacy initiatives in order to assess the implementation and adaptation of this roadmap will have an added value. Poland supports the resolution. Thank you.
Thank you, Poland. Russian Federation, please, followed by Austria.
Глубоко уважаемые коллеги, грамотность в вопросах здоровья является одним из важнейших детерминантов состояния здоровья. Мы всецело поддерживаем инициативы Всемирной организации здравоохранения по реализации мер по развитию грамотности в вопросах здоровья в Европейском регионе ВОС. Мы считаем важным развивать межсекторальные подходы к развитию грамотности с вовлечением различных секторов и заинтересованных сторон для создания условий, способствующих повышению грамотности в вопросах здоровья. Необходимо повышать грамотность в этой сфере лиц, принимающих решения, определяющих политику, преподавателей, исследователей и поставщиков услуг здравоохранения. Мы поддерживаем инициативу ВОС в отношении проведения регулярных измерений и мониторинга грамотности в вопросах здоровья в Европейском регионе ВОС. Мы также считаем очень важным сформировать пул успешных и эффективных практик по повышению грамотности в вопросах здоровья, накопленных в Европейском регионе. Мы подчеркиваем важность повышения цифровой грамотности и повышения качества информации в отношении здоровья во всех возможных цифровых ресурсах. Что касается самой Российской Федерации, то с 2018 года Российская Федерация вступила в сеть действий ВОС по измерению грамотности в вопросах здоровья на популяционном и организационном уровне, а с 2019 года Российская Федерация совместно с Португалией является сопредседателем Европейской сети действий ВОС по развитию грамотности в вопросах здоровья в поддержку профилактики и борьбы с неинфекционными заболеваниями. Особое внимание уделяется сотрудничеству и обмену опытом со странами Содружества независимых государств. В Российской Федерации в настоящее время стартовала масштабная информационная коммуникационная кампания во всех средствах массовой информации, направленная на повышение грамотности в отношении факторов риска хронических неинфекционных заболеваний. Эта кампания будет ежегодно продолжаться как минимум до 2024 года. Мы адаптировали на русский язык европейский инструмент по измерению грамотности в вопросах здоровья, который также, надеемся, широко распространить в странах СНГ. В этом году в Российской Федерации стартует национальный пилотный проект по измерению грамотности с использованием европейского инструмента, в котором мы с включением 6000 респондентов надеемся получить объективную картину по Российской Федерации. И по результатам этого исследования планируется разработать методическое руководство по измерению грамотности и сформировать предложение по созданию национальной дорожной карты по повышению грамотности в вопросах здоровья. У Российской Федерации есть предложение к резолюции, которое мы готовы зачитать при ее обсуждении. Благодарю за внимание.
Thank you very much. Austria, please, followed by Bulgaria.
Danke, Herr Vorsitzender. Gesundheitskompetenz unterstützt eine bessere Gesundheit der Menschen und erhöht die Effektivität des Gesundheitssystems. Und obwohl wir inzwischen wissen, dass Gesundheitskompetenz wirkt, ist eine unzureichende Gesundheitskompetenz in vielen Ländern, darunter auch in Österreich, noch immer ein weit verbreitetes Phänomen. Gesundheitskompetenz zu messen ist ein erster wichtiger Schritt zur Verbesserung. Österreich war und ist eines der europäischen Pionierländer auf diesem Gebiet und setzt sich seit einigen Jahren im Verbund mit den anderen deutschsprachigen Ländern und darüber hinaus für internationale Kooperationen in diesem Bereich ein. Wir sind stolz, dass das österreichische Bundesinstitut für Gesundheit von den Mitgliedern des MPOL-Netzwerks zum internationalen Koordinationszentrum der nächsten europäisch vergleichenden Gesundheitskompetenzerhebung gewählt wurde. Die nächste vergleichende Messung wird uns erstmals auch Daten über die digitale Gesundheitskompetenz in ausgewählten Staaten liefern und damit erheblich zur Wissensbasis in diesem wichtigen Bereich beitragen. Messen ist aber kein Selbstzweck, sondern eine unverzichtbare Informationsgrundlage für politische Entscheidungen und Handlungen. Aus den Ergebnissen bisheriger Messungen lässt sich ableiten, dass eine zentrale Komponente für die Stärkung der Gesundheitskompetenz in der Gestaltung unserer Gesundheitssysteme liegt. Wenn wir wollen, dass Menschen ihre Gesundheit besser verstehen und entsprechend im Sinne ihrer eigenen Gesundheit handeln können, müssen wir so mit ihnen kommunizieren, dass die Information bei ihnen ankommt und ihre Handlungsmotivation unterstützt. In diesem Sinne dankt Österreich dem Europäischen Regionalbüro für den Vorschlag der Resolution und des Fahrplans, in dessen Entwicklung wir uns auch auf der Fachebene einbringen konnten. Wir sehen in diesen Dokumenten eine Stärkung des Wegs, den wir in Österreich bereits begonnen haben, und es erfüllt uns mit Freude, dass die österreichischen Bemühungen im Bereich der Gesundheitskompetenz nicht zuletzt durch Verankerung des MPOL-Netzwerks im Fahrplan gewürdigt werden. Danke.
Thank you, Austria. Bulgaria, please, followed by Germany.
Thank you, Chair. Bulgaria supports the draft of the WHO European Roadmap for implementation of health literacy initiatives through the life course. It aims to increase and further promote health literacy through a comprehensive policy, not only to improve health and physical well-being, but also enhance its role within member states in addressing social exclusion, health inequalities, stigma, and gender stereotypes. The roadmap could contribute to building a common sustainable policy in the European region, to synchronize and join member states' efforts to find effective solutions to improve the health and well-being of the population through health literacy-oriented regional initiatives. In this respect, Bulgaria has undertaken a number of activities towards promoting and strengthening its population health literacy. The Ministry of Health in Bulgaria implements a long-standing policy on health promotion and disease prevention according to the regulation in our Health Act. The protection of citizens' health as a state of complete physical, mental, and social well-being is a priority for us and is guaranteed by the state with focus on health promotion and disease prevention. Attention is drawn to groups experiencing social exclusion. When implementing on-site prevention programs, the main task of the primary structures of the Ministry of Health, like the National Center of Public Health and Analysis, the National Center of Infectious and Parasitic Diseases, the regional health inspectorates, and non-governmental health-oriented organizations, is to educate target groups by providing them with health education materials, protective equipment, counseling on topics related to reducing major NCD risk factors like tobacco smoking, alcohol abuse, unhealthy nutrition, low physical activity, HIV prevention, sexually transmitted infections, hepatitis, drug use, etc. Good example in the area of HIV prevention and control are mobile medical offices, which provide tests, treatment, follow-up, and support. Repeatedly throughout the year, there are days of anti-AIDS campaigns, as well as initiatives to combat tuberculosis and viral hepatitis. During events on related occasions, health education materials are provided for the prevention of HIV, hepatitis. Anonymous and free-of-charge tests are promoted and carried out for these diseases. Materials with appropriate health topics are provided to the mass media as well. Appreciating the impact of health literacy in people's health, there is a concrete measure included in the program of the Government of Republic of Bulgaria for the period 2017-2021, which aims at overcoming low health literacy and improving the well-being of the citizens of the country. focusing on creating networks and platforms using innovative approaches with decision makers in the lead. Bulgaria will support the roadmap and contribute to its implementation at national level, making health literacy a priority for public health. Finally, I would like once again to extend our government's gratitude to the WHO for its continuous guidance, expert and technical support. Thank you very much.
Thank you, Bulgaria. Germany, please, followed by Portugal.
Danke, Herr Vorsitzender. Deutschland stimmt der Resolution und dem Fahrplan zur Förderung von Gesundheitskompetenz im gesamten Lebenslauf zu. Wir unterstützen die darin enthaltenen Ziele und Maßnahmen ausdrücklich. Die wachsende Komplexität der Gesundheitssysteme, die Digitalisierung und die wachsende Gefahr, dass soziale Unterschiede immer stärker werden, macht Gesundheitskompetenz zu einer wichtigen politischen Aufgabe für alle Länder in unserer Region. Gesundheitskompetenz ist eine relevante Gesundheitsdeterminante, die einen entscheidenden Einfluss auf die Gesundheitsgerechtigkeit nimmt. Deshalb müssen vulnerable Bevölkerungsgruppen besonders beachtet werden. Die Stärkung der Gesundheitskompetenz hat nicht nur für die europäische Region Public Health Relevanz, sondern trägt auch zur Erreichung der SDGs bei. Deutschland verfolgt bereits zahlreiche Bemühungen zur Förderung der Gesundheitskompetenz. Vor 2 Jahren wurde die Allianz für Gesundheitskompetenz gegründet. Sie stärkt den Kapazitätsaufbau und verpflichtet ihre Partner zu neuen Projekten für mehr Gesundheitskompetenz. Wir haben einen nationalen Aktionsplan entwickelt, um die sektorübergreifende Integration zu stärken. Wir fördern Initiativen für Gesundheitskompetenz in den Lebenswelten der Menschen über die gesamte Lebensspanne hinweg und unterstützen die Forschung zu praxisorientierten Projekten. Durch das Präventionsgesetz sind die gesetzlichen Krankenkassen unter anderem verpflichtet worden, die Gesundheitskompetenz der Menschen zu verbessern. Hierbei stehen alle für chronische Krankheiten relevanten Risikofaktoren besonders im Mittelpunkt. Aktuell arbeiten wir an einem digitalen nationalen Gesundheitsportal zur Verbesserung der digitalen Gesundheitskompetenz und zur Sicherstellung wissenschaftlich fundierter und gut verständlicher Gesundheitsinformationen. Unter anderem beteiligt sich Deutschland am internationalen Netzwerk zur Messung von Gesundheitskompetenz MPOL. International vergleichbare Daten und die darauf aufbauende internationale Zusammenarbeit unterstützen unsere Bemühungen, Maßnahmen zur Verbesserung der Gesundheitskompetenz mit Evidenz zu belegen. Wir bitten das Regionalbüro, seine Führungsrolle auf dem Gebiet der Gesundheitskompetenz weiter auszubauen und die Mitgliedstaaten bei der Entwicklung eines Aktionsplans zu unterstützen. Dieser Aktionsplan sollte auf den bereits vorhandenen Kenntnissen, Erfahrungen, Strukturen und Netzwerken in unserer Region aufbauen. Ein solcher Aktionsplan sollte die Querschnittsintegration durch praxisorientierte Forschung stärken, eine Verbesserung der digitalen Gesundheitskompetenz und eine kontinuierliche Evaluation des Fortschritts in der Gesundheitskompetenz der Bevölkerung berücksichtigen. Er sollte eine Orientierungshilfe bieten und breit genug sein, um den vielfältigen, bereits existierenden Ansätzen zur Verbesserung der Gesundheitskompetenz Rechnung zu tragen. Gerne bringt Deutschland seine Erfahrungen hierbei ein.
Thank you. Portugal, please, followed by Czech Republic.
Thank you, Chair. Improve health literacy, it is a very important goal for us in Portugal. A lot of work has already been done, and I'd like to share a few of our objectives. We have created within the Directorate General of Health a division called Division of Literacy, Health and Well-being, with the goals to increase literacy and self-determination, promote lifestyle conducive to health and well-being, promote the application of good practices in education, literacy, self-care, and determinant of Portugal health within the health system, propose strategies and coordinate health promotion programs and activities throughout the life course and in different contexts, and develop process and collaborative tools for managing the pathways of a person in the healthcare. We had our own health literacy action plan that focused on keeping the person in the center of the intervention, improving the health literacy levels of the Portuguese population in a sustainable way. This plan supports a life cycle approach and frames its implementation by setting context, the strategy objectives in line with the framework of the National Health Plan, health citizenship, equity and access to healthcare, quality in health, and health policies, and its respective objectives and goals. We have produced a manual from health literacy good practices for training on health professionals, aimed to improve health professionals' communication skills and speech and information delivery, to allow us to activating and capacity building of the Portuguese population. In collaboration with the Russian Federation, we are co-leading the new network of the WHO European Region for Health Literacy for Implementing and Prevention and Control on NCDs. We are also involved in the MPOOL project, the action network on measuring population and organization health literacy was established under the umbrella of WHO Europe and aligned with Health 2020, the European policy framework for health and well-being. The network aimed to institutionalize a regular international comparative European health literacy survey on high quality and support the collective of data and organization health literacy as prerequisites for evidence-based policy and practice on health literacy. We have launched different digital health literacy tools, apps and websites for the population and people-centered. We have an health contact line center 24/7 that offers the population an easy, free, and 24-hour service to contact health professional to clarify doubts, questions, and also they can book appointments to their doctors. We have promoted national campaigns on health literacy, such with the major goals of physical activity, tobacco control, healthy food choice, within the support of multiple stakeholders such as the 4 main national TV channels that are free access to the entire population. That said, Portugal supports and also congratulates WHO for this initiative. Thank you.
Thank you, Portugal. Czech Republic, please, followed by Switzerland.
Chair, Regional Director, distinguished delegates. The Czech Republic strongly welcomes the draft WHO European Roadmap for implementation of health literacy initiatives through the life course. Health literacy as one of the key concepts appears in all important health policy documents, including Health 2020 policy framework. The Czech Republic has been active in the project of the Consortium for Health Literacy and health literacy research in selected EU countries. In 2015, thanks to the BCA, a survey reviewing the level of health literacy was conducted. This survey showed a significant lack in the Czech Republic, not only compared to the countries with the best results in the region, but also to the average level of health literacy in the EU. A working group dealing with health literacy at the Ministry of Health has been established as a response to this dismal situation. We also organized the first national conference on health literacy. Furthermore, the Czech Health Literacy Institute began to operate. We currently participate in the project on systematic monitoring of health literacy in the European region MPOL. We have initiated, as a tool to increase the level of health literacy, a preparation of the National Health Information Portal. In cooperation with the National Institute of Mental Health, the Ministry of Health, within the framework of mental health care reform, prepares a research project focused on the level of mental health literacy and subsequently a program of mental health literacy support. To conclude, I would like to stress that the Czech Republic supports the adoption of the resolution as well as the WHO activities to map all aspects of health literacy in particular countries, but above all, to increase the level of health literacy among population. Thank you.
Switzerland, please.
Madame la directrice régionale, Monsieur le Président, chers délégués, la Suisse salue le projet de feuille de route européenne de l'OMS pour la mise en œuvre d'initiatives en matière de littératie en santé à toutes les étapes de la vie et remercie le Bureau régional pour l'implication des États membres dans l'élaboration de ce projet. Renforcer le pouvoir d'agir des citoyens par l'amélioration de la littératie en santé et donc par l'acquisition de connaissances et de compétences personnelles est essentiel. C'est notamment l'accès à des personnes en situation d'exclusion sociale qui est tellement crucial. Consciente que les défis restent nombreux, la Suisse s'engage activement dans le cadre du réseau MPOL pour une meilleure équité en santé. Au niveau national, des programmes destinés à des migrants ont été utiles. D'autres engagements vont suivre. La Suisse se tient à disposition pour participer aux activités en cours du bureau régional dans le domaine de la littératie en santé. Je vous remercie.
Thank you very much, Switzerland. And as I see no other delegates asking for the floor, I give the floor now to EuroHealthNet.
The proposed roadmap for implementation of health literacy initiatives throughout the life course. We see the calls for action on promoting health in the 2030 agenda as a means by which progress can be achieved and measured regionally and globally. We're pleased that the initiatives to implement the Shanghai Declaration are being actively taken forward by the Regional Office for Europe and by many member states. However, there is much to be done, in some cases urgently. Improvements are needed from pre-primary school children right up to our prime ministers. As the roadmap shows, only around a third, about 19 European member states, are currently developing sufficient policies, despite the definition of health literacy being in the WHO Health Promotion Glossary since 1998. Now, that definition has, of course, been updated and overtaken by developments and innovations, which offer both opportunities and challenges, and we believe the roadmap can play a significant part in addressing them. There is also a new impetus which makes health literacy an even more dynamic determinant of health and equity, and that's the rapid digital transformation of societies and systems, including promotion and preventive systems and services, to which many citizens in this European region have new rights of access. So it's welcome that improving digital health literacy is among the 5 strategic directions in the roadmap that were so well set out in the introduction this morning. That's not least important because of all the reasons that have been mentioned in debates throughout this morning's sessions. So point 39 in the draft recognises this new dynamic very well and sets out how integrated approaches are vital, including co-design right the way through initiation to evaluation. Point 41 highlights its importance on policy agendas. So we welcome suggestions in point 43 for actions in all settings and to decrease inequalities and social exclusion. But we hope these will swiftly become more strengthened commitments which can be effectively implemented in the new tools and partnerships being established. We've published our own policy précis on digital health literacy, how new skills can help improve health, equity and sustainability, which contains stimulating examples from our partners and many of the member states who have spoken this morning, plus recommendations on policies, protections and practices, public and professional engagements, which have been developed by our experts. We hope that this and other resources through our website, including with the WHO Europe Coalition of Partners, a brand new investment guide and online tool for policymakers and practitioners, will add real value to this draft roadmap, and we look forward to contributing towards these improvements and to successful outcomes. Thank you very much.
Thank you. And now I give the floor to International Pharmaceutical Students Federation.
Honorable Chair, distinguished delegates, it is a great honor to speak on behalf of the International Pharmaceutical Students Federation, representing over 350,000 pharmaceutical students and recent graduates from over 90 countries worldwide. In the current digital world, targeted mass media and social media campaigns are one of the key strategies used in health promotion. IPSF acknowledges that health information can easily be made accessible to the public through such channels, which greatly improve health literacy. However, it also leaves the public prone to misinformation, especially with regard to health matters, which may cause adverse effects on the health systems. An example is the rise of vaccination hesitancy, one of 10 current global health threats, which has contributed to recent measles outbreaks incidents. Implementation of policies regarding the responsible use of media is inevitable, as it plays a crucial role in disseminating evidence-based information to ensure safe and efficient delivery of health services. Moreover, a key factor affecting health literacy is education. IPSF recommends utilization of health professionals as an expert reference for health information dissemination and improved quality of health promotion. Conducting public health campaigns on safe and healthy lifestyle, demonstrating proper use of medical devices and patient counseling on current therapies, all contribute to augmented self-care interventions. A review of 39 studies showed that more than 1,300 asthma and COPD patients indicated 91% inhaler technique improvement and a significant decrease of exacerbations after educational interventions provided by health workers. IPSF urges member states to make health literacy a public health priority and utilize the accessibility of healthcare professionals to engage hard-to-reach populations. Pharmacists currently aid the patient's understanding of prescribed therapy and non-pharmacological measures with evidence-based prevention procedures. With these skills, if applicable, community pharmacists could use mHealth technologies to collect and monitor health data in addition to supporting the training of community health workers. Ultimately, IPSF will continue to advocate for accessible health services for all towards more resilient health systems. Thank you.
We thank you very much. And now let us consider the adoption of the proposed draft resolution contained in EU/RC69/ConfDoc/12 towards the implementation of health literacy initiatives through the life course. I understand that there are some proposed amendments. Russian Federation has the floor.
Спасибо, господин председатель. Российская Федерация совместно с Евросоюзом по результатам предварительных согласований предлагает две правки в резолюцию. Первая правка в параграф номер 7 в преамбулярной части, которая начинается со слов «recognizing that putting health literacy». Цель правки заключается в том, что для того, чтобы можно было принять обоснованное решение в пользу здорового образа жизни, необходимо создать условия, в которых такой выбор мог бы быть возможным. Поэтому правка звучит следующим образом. Recognizing that putting health literacy into practice empowers people to improve their own, their families, and their community's health, including, inter alia, by influencing their living and working conditions, and requires the creation of healthy environment and choices to enable health-conducive lifestyles. Вторая правка предлагается в пункт 1F, в которой упоминаются существующие инициативы на площадке ВОС в области health literacy. Предлагается добавить вторую сеть, которая действует на площадке ВОС. Как мы знаем, упоминалось две сети. Первая занимается измерением, вторая занимается наделением стран возможностью планировать и реализовывать мероприятия в области здоровья, грамотности в области здоровья. Таким образом, правка следующим образом. To consider participating in networks and other ongoing initiatives in relation to health literacy of the WHO Regional Office for Europe, such as the WHO Action Network on Measuring Population and Organizational Health Literacy, and the WHO European Action Network on health literacy for prevention and control of NCD. Спасибо.
Thank you very much. As I see, there is a proposition for agreed amendments from Russian Federation and EU. Finland, please, you have the floor.
Mr. Chair, thank you very much for giving me the floor. The EU and its member states welcome the proposals made by the Russian Federation on amending this resolution. We have two editorial issues regarding the first amendment, and we would like to make sure that after the words working conditions, there will be a comma, working conditions, comma, and then we would like to see the word environment in plural, environments. And we hope that this is acceptable to the Russian Federation and the delegation. So I will read the paragraph from the middle as it would stand with these amendments, comma, including inter alia, comma, by influencing their living and working conditions, comma, and requires the creation of healthy environments and choices to enable health-conducive lifestyle. Thank you.
We thank you very much for the very clear statements. Do you want to add something, Russian Federation?
Да, хотел поблагодарить, мы поддерживаем. I wanted to support, to thank, we support this.
It seems very clear, and thank you for being so clear. So, I ask from the rapporteur to read the amended paragraphs as they are now. Please.
Thank you, Mr. Chair. So in the preamble paragraph beginning with recognizing that, there is suggested change proposed by Russian Federation and the EU to be inserted after the words working condition, and proposed change reads requires the creation of healthy environment and choices to enable health conductive lifestyles. The EU proposes to add comma after the words conditions and to add s in the word environment, which will then read environments. So the revised preambular paragraph reads as follows. Recognizing that putting health literacy into practice empowers people to improve their own, their families, and their communities' health, including, comma, inter alia, comma, by influencing their living and working conditions, comma, and requires the creation of healthy environments and choices to enable health-conducive lifestyles. Referring to the operative paragraph 1.f, there is suggested change proposed by Russian Federation and the EU to add after the word literacy the following: and the WHO European Action Network on Health Literacy for Prevention and Control for NCDs. The revised operative paragraph 1.f reads as follows. To consider participating in networks and other ongoing initiatives in relation to health literacy of the WHO Regional Office for Europe, such as the WHO Action Network on Measuring Population and Organizational Health Literacy, and the WHO European Action Network on Health Literacy for Prevention and Control of NCD. Thank you.
Thank you very much. Having heard the amendments to the draft resolution, is the committee willing to adopt the resolution as amended? I see no objection, so the resolution is accepted.